Hello, and welcome to another edition of In Medicare News. Today is May 14th, 2018, and this video is put up in response to an article on May 9th, 2018 from Modern Healthcare. I will have a link to the article in the feed, and the title is CMS to Simplify Medicare Plan Selection. In response to a report that was published by the National Council of Aging regarding plan choices in Medicare, CMS is the Centers for Medicare and Medicaid Services. That's the government portion of Health and Human Services that oversees Medicare. They have decided to tweak the Medicare.gov plan finder and undertake a redesign of the website. Now, this is both good news and bad news, and I kind of wanted to mention this and also give some background so you don't know what it is. So the Medicare plan finder is what a consumer can use to do an apples-to-apples comparison of different Medicare Part D prescription drug plans based on the prescriptions that they take should they actually enter it properly. It also gives Medicare Advantage advice in there, although it does not give Medicare Supplement advice, which is mentioned in here as one of the deficiencies. It is designed, I think, about 12-13 years ago and has really undergone no changes since then. The plan finder is actually very useful, and it's pretty much the only place a person can go to get a real apples-to-apples comparison of all the prescription drug plans and Medicare Advantage plans, especially as it relates to many aspects of their health insurance. We use it. It is our main tool for picking a plan. We don't work for insurance companies. We're brokers. We work for the clients that hire us. Therefore, it's very difficult even for us to keep track of all the differences. You really need a way to actually search all the plans evenly, and the Medicare Plan Finder at Medicare.gov is really the only way a person can do that. So by making these changes, they're actually going to be doing a lot of good things here, and I printed the report by the National Council of Aging. I will have a link to that report in the show notes here as well, but there are a few things I did want to mention. They're quoting on page 6 of the report, another concept at play is the degree to which beneficiaries have an understanding of the basic tenets of health insurance and know what types of coverage are needed for their specific health needs. I probably should have mentioned that last, but I want to mention that first because what this report is saying is part of the biggest problem is you can buy this coverage without actually understanding what you're buying. That's actually a problem through all of insurance. It's actually a reason I have a job. You don't need me to technically buy it. What you need me for is to help understand it. And I know nobody likes being told that they don't understand something. And a lot of people think they have an understanding of a lot of things, myself included, in life that we really don't. Insurance is kind of one of those things. You really need somebody who understands health insurance and how it relates to you to explain how health insurance relates to you. And if that sounds redundant, it kind of is, but it's kind of that way because it's a big problem. Health insurance is not just finding and I've said this before on other doctors, health insurance is not just finding getting a primary care doctor for $5. It's not just getting a fitness benefit, which, by the way, drives me crazy. Again, that's on another video I've mentioned. Health insurance is more than these things. It's kind of a conglomeration of things, including trying to find the plan that's going to work best for you for health issues that you don't even have yet. That is a problem. If you think your health insurance is fully changeable, in the future, that may not necessarily be the case. And if you have a type that can change in the future, it may not change at the time you need it to change. So you really kind of need your health insurance to be all things for you at all times. So you've got to find the right thing at the right time in the right way. And the Medicare Plan Finder is kind of one of those invaluable tools for doing that. Unfortunately, most people don't know the questions to ask, and that's kind of where we come into play. So part of the problem is on the Medicare Plan Finder, these things we're trying to find are not easy to find, first of all, and some of the information isn't even there. Now, one of the other things that I mentioned earlier is that the plan comparisons currently on the Medicare Plan Finder do not include Medicare supplements. That's an issue. Medicare supplements, neither of these things are called what the government's terms are for them. A Medicare supplement, the actual term the government uses, is Medigap. Medicare Advantage plans, the actual term the government uses is Medicare plans. So neither of these things are to the government on these sites what you or I would call them when we would be talking to one another. So that's something else to be aware of. On the Medicare Plan Finder, it's going to give you Medicare Advantage plans and Medicare prescription drug plans, but it's going to exclude in your options the Medicare supplement. That's a problem for the simple reason that that leads many people to believe that the Medicare supplement is not an option available to them. That's an issue. As a matter of fact, it's easier to find more Medicare supplements than it is Medicare Advantage plans in many places, because Medicare supplements are generally regulated by the states, or available by the states, excuse me. Medicare Advantage plans are available by county. So you could live in a county that has 2 Medicare Advantage plans, and if that's all you see on the Medicare Plan Finder, that may leave out the fact that there may be over 40 different Medicare supplements available to you, and you're just going to choose one of the 2 Medicare Advantage plans. Again, that's one of the reasons why I exist and why I have a job, so that I can tell you, hey, there's this other section that's not on this site and it's available. And I've had to actually get into, in some cases, arguments with clients, letting them know, yes, I understand that what you're looking for is not on this website, but it doesn't matter. It's still available. And, you know, there can be kind of a credibility issue where if I'm just meeting these people for the first time telling them this, and I'm contradicting the information that they are seeing on a government website, excuse me, it doesn't work well for me to contradict a government's website, even though I'm basically saying, look, there's an omission here on the government's website. It's not a contradiction. But a person is going to believe whatever they want to believe. So, I mean, that is an issue. That the plan comparisons on Medicare.gov do not include Medigap or Medicare supplement policies. Now, there's a whole other issue there of, okay, a Medicare supplement, it's very hard to show a rate because the rates fluctuate so much. They change based on age, gender, tobacco use, zip code in a lot of places. Not to mention there's a whole bunch of different plans. It can actually make problems a little bit deeper with Medicare Advantage than they would with Medicare supplements than they would normally be with Medicare Advantage, as anyone who's tried to buy a Medicare supplement online knows. However, these are kind of incremental issues that can be fixed at a later time. The bigger problem is the fact that there are no Medicare supplements right now on Medicare.gov. A lot of people, if they are just using Medicare.gov to buy a plan or to choose a plan, they may not even realize that Medicare supplements exist. Now, the other thing I kind of wanted to draw your attention to is on the report from the National Council of Aging, page 11, number 7, human support is not available. Now, why is that important? Well, a lot of times, again, you don't need a human, you don't need me to buy insurance, but you need me to explain the insurance. And I'm sorry, I know that there's a lot of commercials out there for different types of insurance about how, let's say, easy and simple it is to purchase that insurance. But that doesn't mean that you're not going to need someone to explain these things in the future. Medicare products are the exact same way. I would actually argue part of it is because I built a business based on it. that Medicare insurance is much harder to understand than other types of insurance that are, say, commonly purchased online. You may know what a deductible is, you may know what a co-insurance is, which is great for you, you understand that, but you may not realize that just because your doctor takes company A in the past doesn't mean that they're going to take company A through the Medicare Advantage plan. You kind of need somebody to run through those if you are just taking that for granted, and you'd be surprised how many people do that. Many people think that there is full dental coverage on certain plans that say they're going to offer dental. They don't realize that there is a difference between comprehensive dental and preventative dental. Many people don't realize that there is a difference between being admitted into a hospital and being observed in a hospital. Those two, and depending on which way you are going into that hospital, it's going to indicate different payments. Even if it's a Medicare supplement, it's going to indicate a different part of Medicare is going to pay those payments. Somebody kind of needs to explain that if you don't know. Kind of more importantly, or as importantly, is the drug side of things. You know, somebody takes metoprolol. I'm just pulling that one out of a hat. Someone takes metoprolol. Are they taking metoprolol tartrate, or are they taking metoprolol succinate? Is one ER? Is one not ER? Are you taking 100 milligrams? Are you taking 50 milligrams? Why is that important? Well, it's important because if one of those drugs is a tier 1 drug on the plan you're choosing, it could cost you $2. If the other one is a tier 3 drug on the plan you're choosing, it could cost you 20%. Now, the difference is 20% of a drug that may be about $30 is going to be way more than $2, especially if you're expecting to pay $2. So this is one of those things where somebody really needs to check these, and a knowledgeable human, be it an insurance professional like myself or a person from the state senior health insurance personnel that helps people out if you contact them, they're able to help you as well, or you know, other people that actually have some understanding of how Medicare health insurance works. They're able to actually ask these questions, plug it in, and get you a fairly accurate answer, because don't forget, a lot of these plans, once you're in them, you're in it for a very long time. Another common one is immunizations. Now, a lot of immunizations are covered under the under Medicare Part B. However, if you need a shingles shot, that is typically covered under Medicare Part D. D is in drug. That brings up things like copays. Is it a brand drug? And it usually is right now in 2018 as we're recording this. A brand drug generally has co-insurance, which means you're paying a percentage of retail. And in a lot of cases, you're doing it after a deductible. Now, if you're expecting it to come under Medicare Part B, where these things are fully paid, again, this is one of those things somebody kind of needs to tell you about. So that's kind of why this is important. And if it sounds like this news video that I'm giving is kind of self-serving, and in a lot of ways it sounds like I'm kind of giving you an advertisement for me and the services that I offer, in a way, I kind of am. I mean, that's not the real intent here. The real intent here is to inform. But I mean, the purpose of Medicare's redesign of the Medicare.gov site is so that people will actually have a better understanding of choices. And this is coming up as a result of a report that's showing the deficiencies in Medicare.gov right now. My business is in a lot of ways how to translate what's in Medicare.gov to people. I use it. That is my primary tool. I'm going to be able to continue using it, and you're going to be able to continue using it too. But the reason I'm doing this video is to point out, just because they're going to pull out some things here to make it easier to understand, it's still important you go and get these questions answered by somebody who knows what who knows the insurance and is willing to kind of ask you some of these questions where someone's got some experience, knows how insurance works, and will be able to tell you, okay, look, this is going to be fine for this, but if this is a concern to you in the future, be aware of what the limitations are of this plan. Medicare.gov is going to do a great job of bringing all the information together so that you'll be able to find what you need and will be able to pick apart the various aspects of each plan and show you how to compare it. But the questions that need to be asked: how will this affect me, and is this other benefit over here, this other cost over here, going to actually matter to me in the future? And that's kind of where this is coming from. So Medicare is going to be doing a redesign of Medicare.gov. It's based on this report. There's a lot of things in this report. I'll link it to you in the notes to this video. But really, what this comes down to is there's going to be a change. They're going to make it so that it's more automated and easier for you to pick out a plan. However, there's still a need for talking to someone, sitting down with someone, and going over this. The last thing I'm going to tell you about this with regards to why you should consider seeking outside help, it's because there is a rule that Medicare has that anyone like me that's going to help you out cannot charge you a fee for doing it. What that means is the insurance that you eventually purchase, and you will eventually purchase insurance because very few people just go with Medicare and nothing else. There's a whole bunch of reasons for that, and if you don't know what they are, take a look at our website, mymedicareinsider.gov, and it will go over, that's not right, mymedicareinsider.com. mymedicareinsider.com, and it is going to go over what those other reasons are for using an insurance agent or a broker. But I mean, really, you are going to get insurance eventually, and you are going to pay the same price whether you use me or someone like me, or whether you go and get it yourself. So what you get by going through someone like me is advice, someone to take your situation and kind of plug that into Medicare and see what the plan is going to be and which plan is going to be most appropriate for you. And a little bit of ownership, some accountability. In other words, there are consequences if we don't put you in the best plan. If you put yourself in a plan that's not appropriate, the only consequences are you. There's nobody you can blame. I know it's great to blame the government and other people, the insurance companies, but I mean, really, there's no one to blame but yourself if you put yourself into the wrong plan. There is an accountability level to us that, if we're ever called to task for it, we have to account for. Why did we put you in a plan? And the information that we pull up from Medicare.gov is crucial for us in saying, look, these are the reasons we put somebody here. And that accountability is for your protection, so that you do not get put into a bum plan, or you are not put in an inappropriate plan. So you get all that for the cost of nothing. It costs you nothing more to use us than to not use us, and that is a tremendous value to you, a tremendous benefit to you. So make sure that when you do see the stuff on Medicare.gov, give a call to someone like me that's able to help you out, that's willing to go over how Medicare works and how these plans and specific to your situation are going to work, and that is going to help you find the best plan regardless of whatever Medicare does. So thank you very much. We're going to do another one of these videos as more news comes up. We seem to be getting them now about once every couple of weeks, once a month, and yeah, we will keep you informed of more healthcare issues and more Medicare news as it comes up. Please subscribe, like, Join our Facebook page, and if you have any questions, just ask.